I keep looking at my clock until 3:30. No, okay, very good. Thank you. Sorry. Good afternoon and welcome to the Buncombe County Home and Community Care Block Grant Advisory Committee meeting for September 24th of 2025. We've got a couple things on our schedule, on our agenda today. So let's start off with our standard housekeeping. Hi, Allison. Is there any revisions to the agenda? Hearing none, can we have approval? Motion to approve? Suzanne, second? Taylor. Okay. And then the meeting minutes. Any corrections or updates to the meeting minutes? Hearing none, do I have a motion to approve?
Motion.
Second.
Okay, excellent. Moving right along. Welcome back from vacation, Billy.
Thank you.
As we go into the units of service and the Buncombe County supplemental aging funding reports, I just want to be mindful that we are early in the fiscal year, but as you can tell, and I always have to refresh my memory, and Zach, correct me if I'm wrong, with the units of service, if we look at the fourth column from the right, which is grant percent, that is what has been, what can be reimbursed, correct? And then the next one, percent of grants served, is what folks have used.
Correct. So the grant percent is what is allowable through the 1/12 payment through ARMS, and the percent of grants served shows the entirety of the grant that they have already put into ARMS, and that encompasses these units served but not reimbursed in this column right here. So you can see that some of our people are quite ahead in their spending already, but I'm not too worried about anybody in particular not spending. Let's see here, what is this? This is the Senior Companion Program. It's probably just Dee and Vicky are so covered up currently, and they haven't had an opportunity to enter units yet, but I will get on them to do that so that it'll show by next month.
That would be appreciated. What struck me when I looked at this is that the percent of grants served shows, it really shows the demand for these services in our community. Specifically, if you look at Pisgah Legal, I mean, they're already at 250%. And I don't know if other folks saw it, but I saw in the Citizen Times that they'd had to let like 12 lawyers go because of lack of funding. So there's demand, but it's kind of ominous with the funding situation.
Yes, and I'll just add to that too. We are hoping for a budget passed October 1. I don't know that that will happen. It may just be a continuing resolution. However, if a budget is passed, there's a chance that it could be below what we already determined we had for the year. And if that's the case, we'll need to contact our providers and, kind of claw back some of that funding. And it's the reason why we told them to please spend um, conservatively until we have a finalized budget. I'm hoping, fingers crossed, that it is actually more and that we'll have some funding to give extra. But, it remains to be seen at the moment.
So Zach, that's funding from the General Assembly, am I correct?
Correct.
Okay. Okay, moving on to the supplemental aging funds, I did see an email from Billy. I can't remember if it was yesterday or this morning, but the chart that I sent out should have an addition under Mountain Aging Partners. And that was it $91.83, Billy?
Yes, yes.
So they
So
have,
yeah, that invoice came in last week and it's been processed. So I sent everyone the updated form, but that's the only addition to this spreadsheet.
now, like I said, you're just back from vacation, but do you know if all the contracts have been executed?
Yes, except we're still waiting on Mayhec's contract to be fully executed. We're waiting on the final signature and notarization by the executive director there. And we're still waiting.
Okay,
And they've submitted 2 invoices, but I can't submit the invoices to finance until the contract's fully executed.
okay, and I'm sure that's been duly communicated to them.
Oh, yes, finance has been reaching out weekly. Yes.
Okay. I guess I'm just nervous about these funds because we're not able to shuffle them around at the end of the year. So I want to encourage those providers who are getting these supplemental aging funds to please invoice timely and utilize the funding, or possibly next year there will be even less. That's
And
my,
I wanted to say that Blue Ridge Pride told me that they would not be submitting an invoice for August because they're focusing on the Blue Ridge Pride Festival, and after that's over with, then they'll start invoicing and doing the Generation Plus Connections events.
excellent. It's still early days, but after seeing, how should I say this? After seeing the current tide of funding from the federal government, I just want folks to be aware and to do the best they can with providing the services and getting payment for those services. So does anybody else have any comments on the expenditure reports? Okay, hearing none, I do want to go on to the year end summary, which was Billy, it was great. I don't know how you have time in your working life to do all this, but it just I don't know, almost brought me to tears in some cases, looking at some of the comments and seeing how the funding that we're able to allocate does impact our our neighbors in our community. I just want to shout out a couple of things. So like, I'll start with Blue Ridge Pride, and, you know, we talk about social isolation can be, you know, it is such an impact on your physical health. And the comment about the Generation Plus Gala, the comment was, I felt so connected to my peers in a way that I was never able to throughout my life. Thank you. The summary also shares the impact of Helene on our county. I was chatting with a colleague from the Senior Tar Heels today, and she lives out, like, I think near the coast, and it's kind of hard for folks who don't live here to understand what we went through. And some folks, even myself, I'll say, you know, you kind of get back to whatever your normal is, but you got to remember not everybody is in a good spot right now. The one story is with the Council on Aging, the nutrition program, talking about a gentleman who moved recently to Asheville, and he was at the Grove Street Center, and he had gotten introduced to the farmers market nutrition voucher program, and he lost his wife shortly thereafter, and the center ended up to be a lifeline for him, especially after the hurricane and losing his wife. The other thing that kind of struck me, and I also have to, and I've mentioned this before, Allie Climo would always talk about building capacity. And so when I looked at the Jewish Family Services, like on the 4th page, they're strengthening their partnerships with Memory Care, Mountain Care, and the Council on Buncombe County Council on Aging. Again, they also talk about their partnership with Advent Health on the Health Solutions Counseling, at the PACE program, Black Mountain Counseling Center, and Friends and Family. I mean, you know, as we start, I mean, over the past few days, I've been thinking about our core mission, philosophy, and I keep coming back to the capacity, the building capacity. Allie would be proud of us. But I also was impressed with and maybe this is the accountant in me, but the statistics that the providers were doing surveys. They were able to, you know, be able to quantify the impact of their programs on the residents that they serve. For example, Mountain Care has in their quality impact, 84% say adult day helped delay long-term care placement. So as all this stuff swirls in my head, I like to be able to say, okay, that's something that I can go and say in front of a legislator, hey, this is how this money benefits the community. I'm trying to think. Oh, and the working wheels on the last page, having moved here, and I'm getting kind of personal, but having moved here from a metropolitan area, I just can't imagine how folks would be able to get around if they didn't have a car. And so I think working wheels, the comments were I don't worry anymore. I'm not stressed and feel safer about driving in rainy weather. My car would have become unsafe and non-functional without this program. So, I mean, it's just incredible what these providers are doing for our friends and families and neighbors in the community. And Unite, which is new to us as a funded provider, I mean, they were able to say, you know, we had 3 sessions and we averaged 8 participants, but that increased over time to like 11 to 17. So as their program grew, they were able to help more folks. I don't know. I think Billy does an excellent job in consolidating all this. And I think it's a worthwhile document to share with folks and just to read through and remind each of us what we're doing is helping folks. I know that's kind of corny, but that's me. Anybody else have any comments about the summary?
You know, that's critical though. The quality of people's lives is improved. Their health and safety is improved. There are knockoff downstream impacts socially in the society as a whole that are positive. And we're keeping people out of nursing homes. I mean, I don't know how many of y'all have visited a skilled nursing facility, AKA a nursing home. That's not a place you want to be. That's where you go in a dire emergency and hopefully you're unconscious while you're there. And we're helping to, keep people from premature moving into facilities like that can provide a certain level of support that they might not be able to get in their home, but these programs help them get those services at home. So should be obvious, but it isn't to everyone.
I just want to share that I sent out this report to all of the funded providers because they need to see all the outstanding work that's being done in the community as well as what they're doing themselves. And it was a very challenging year in FY25. So I sent it out and I hope that they read it and applaud themselves for all the good work and applaud each other.
And I'll just add to that too, Susan, I don't think it's corny at all. This is all information and facts that I get to see while I'm actively out monitoring. I get to see the 100-plus-year-old that's able to live independently because Meals on Wheels provides her a meal every day of the week. I get to see the recipients of adult day care and how their life sometimes gains purpose to it because they have a place to go to. And I think that this report is really something because, I mean, while we all kind of sit at desks and make decisions about money and things like that, it really humanizes what we do. And, to Billy and I and Allison, we all see it in our daily lives doing the work that we do, but sometimes I think it helps to add the personal stories to it to show that what we're doing is incredibly needed in this day and age.
And Billy, this is where you're supposed to put the percentage of adults that are over 60 in the county. What is it getting close to 39 or what? 29, I think, percent.
Yeah, it's about 28 or 29%. Yes.
Of folks are 60 plus. Myself included.
Me too.
The other thing kind of selfishly, and I'm glad you sent it out to the other providers, Billy, is it shows them how their other grantees had gotten, how are able to collect statistics. I think some of the summaries are more robust than the others. And I think the folks that maybe aren't as robust could kind of look at, well, is there something similar I could collect and share in my next application? That's kind of all this whole application and, you know, funding is kind of whirling around in my brain. So I think that shows everyone that, you know, you need to be able to at least quantify the impact to help others understand how much how many folks you're reaching and what is your impact in the community. Which kind of ties really well in with the Better Together transportation document that, and I'm sure I'm going to pronounce this wrong, Injuno, Billy? Eugenio Perez sent.
Perez.
And he apparently listens into and dials into our meetings. And he sent this to us. And I got really excited because it gave a visual of the county, but also as Zach is scrolling through, it shows what the purposes of the trips were. Now, I'm not quite sure what administrative errands are towards the bottom, but I mean, grocery shopping was number one. So this is something, I mean, I think this would be something that would really strike a legislator and say, wow, this is, you know, this provider is, this program provides this services, and this is what it looks like. Like Zach was just saying about, you know, he sees it every day, but somewhat, you know, maybe the rest of us aren't out there, you know, seeing what's happening, as the expression, boots on the ground.
What I've noticed over the years is most people don't seem to employ a lot of imagination when it comes to the need to provide caregiving or advocacy services for a friend or a relative. And when they find themselves in it, many people become very quickly overwhelmed. Well, gee, I never thought I'd have to like run a taxi service, and oh yeah, I have to go talk to a bank or whatever. Dealing with the healthcare system alone is a massive time sink. And I think the ability to provide a picture, you know, of the kinds of things, you know, in a simple graph of the sorts of things people have to think about when they aren't completely independent anymore. When you're going in front of, you know, a legislator, you know, someone with grant money that maybe you're trying to get a little access to, you know, a simple one-page, you know, picture, if you will, can speak 1,000 words and be enormously helpful. Because, you know, I'm surprised actually when I talk to people, you know, well, why don't you just, what do you do in your average day? And if you can't do these things anymore, what kinds of help would you need? And most people don't seem to think about it too much, in part probably because they don't want to until they're thrown into it.
Yes, even those of us who have worked in long-term care don't always want to plan for that kind of stuff. So does anybody else have feedback about Better Together document? Well, I would be curious, and maybe after this meeting is over, Billy can touch base with them and see if they have suggestions for how other folks might be able to collect demographic information. I remember going to a learning session down in Brevard, and when we signed in not just our name, but our zip code. So that was something pretty easy to do, to collect information. So Suzanne, I am glad you're on the Zoom today, because there's no way in the world that I could communicate all the stuff that you had in your emails to me. And I think you included Billy too.
I'm
So
sorry
Zach,
for a failure to herd the words.
No, that's quite all right, because I think you put on paper what's been swirling around in my head, all these different thoughts. I did a little bit today. I did a cut and paste in terms of, trying to start articulating a core mission or a philosophy or purpose. And like the 1, 2, and 3, that came from one person. And then the dots that are in the same column, that came from another person. And then I added reduce social isolation. But Zach, if you could stop here, this is the block grant philosophy and purpose. And what I found what I found interesting and what jumped out at me was the fact that they said older adults, family caregivers, this is the second sentence, as well as local service providers, often face a very complex and fragmented system of services. And I think I've heard that a number of times from folks in this committee, resulting in part from different eligibility criteria, service definitions, or service, blah, blah, blah. So the block grant, as it goes on, was designed to begin addressing the complexity by consolidating under procedures. So to me, that goes back to the build capacity. So I think that's one thing I would like to see, the building of capacity, along with, as you can see up top. This is Zach, if you can scroll up top, please. Thank you. Like, support the safety of older adults, live in a least restrictive setting. And so that it kind of all blends together. So I don't know, help me out here, Suzanne, or something. I'm struggling to wordsmith our core mission.
I think when I read through this bit with all the text, there's a lot of words, and you can read through it and think about it and try to pick out the main points. I think summarizing the objective, which is, the safety of older adults, the ability to live in the least restrictive setting, as in keeping people out of nursing homes, the ability to contribute to society via paid or volunteer work, which is part of the socialization aspect of it.
Mm-hmm.
The quality of physical life, intellectual life, psychological life, reduce social isolation. Those are the main points. And then, in support of that, building the capacity within the community to accomplish these things. And I think that's I'm not sure how we do that. In my experience, I'm referring to one particular situation, which was not an older person, but it was someone with a severe intellectual disability. What was challenging for me as someone who wasn't brought up in an environment in which I had, routine contact with social services, didn't become a social worker. I was surprised at how disaggregated access to benefits is. You go to one place for, you have Social Security disability. You go to a government office, for SNAP, another government agency for Medicaid. If you're getting Medicaid waiver program benefits, you're getting that through a nonprofit where the work is outsourced to that nonprofit by the government, and so on and so forth. And within the community of social workers that work in these different agencies, they often don't know what other agencies do. They are not always well-versed in other benefits that the client may need or have access to. And when there's this vague idea that those things are out there, they generally don't know how to access them. So it makes the work of a caregiver advocate complex and time-consuming. And it's very inefficient. And unless that advocate, I'll say it, has what's the word? It's very persistent, can be a little pushy, is in a politest way as possible. The person who has needs aren't having those needs met. And, that seems to be that's certainly the case in the elder care sphere. I was lucky with my elders that I didn't have to engage with the social services much. But it's, what I would like to see, and again, I don't know how we do this, I would like to see more coordination of access so that, you have needs, but you don't know how to, like, who do you ask for help? How do you get that help? And, one of my concerns, of course, are individuals who do not have advocates, family members, or friends to help them. What happens to them? I don't know. I don't know if I'm making sense today.
Well, I think you're making sense, Suzanne, and what you're describing brings to mind one thing that I wanted to say earlier, which is what Billy sent out to all the agencies. The report also is making each one of those agencies more aware of what is available and
Yes.
possibly how to do it, how to contact, bringing the system more together for them. And what you were just saying now about it being so everybody has their own application, their own rules, their own everything. That was was my job at the Council on Aging with information and assistance. When someone would call, we had a list of all the services that we were aware of and numbers of who they could call, and we would advocate and call for them. And it was a very good program. It's very time consuming, but there are more places like that. It was all under one roof. So when they would call for food stamp, we'd go, well, if you're eligible for food stamps, what about, do you need Medicare? Do you need a ramp at your house? What about your AC or heat? And go on through the questions that they had really weren't, they may need them, but they didn't know there was help out there for them to have it even. So when you go to someone's house and you go in and they're freezing in their house, but you're there to help with food stamps because they never even thought about the fact they could be warm. And it's a big disconnect. And it's a very complicated system. And I think we need more organizations to understand how it all has to blend together to work together.
If I can say something, and I'm going to have to apologize because I'm reaching back in my memory. Once upon a time, there was a program, or at least an intended program to set up, I think they called it the Justice Center at, I don't even remember what the building was, someplace downtown around First Baptist Church or something. And the idea there was to have offices from each of the various agencies and to locate various agencies, or at least a representative in the same place, just for that reason. So when somebody came in to, you know, like you said, for food stamps or whatever, they could also go over to the other one. I was not involved with that, so I don't know how, if it came to pass. I sort of think it did come to pass, or how effective it was or anything. But I can mention one thing that, and I always thought that the Council on Aging did that to a degree, and I thought they did a fairly good job at doing that. I'm not sure that's still happening that well. But one sort of unrelated thing, but maybe something to think about, that aggravated me at one point in time when I was handling guardianships, which often involved an elderly parent and, you know, family members who, believe it or not, you can have a lot of sisters fighting over their mother.
Yeah.
There were programs that we tried to work with that provided services like for families with kids. You know, mediation center would have programs where parents could come and switch kids and whatever and so forth and so on. And I remember, you know, trying to get them to do that for some of my elderly clients, so that their daughters didn't end up trying to kill each other in front of the bank when they were switching cars or whatever. And they just said, no, you know, our program is, our cutoff is 18 years old. So, you know, we don't do anything for anybody over 18 years old. And I do wonder from time to time if we could sort of edge our way into some of these other programs that are working with kids, disabled people, younger people, or whatever, in terms of information sharing, because a lot of it is very similar.
How do we as a committee, I mean, we can't say, okay, as a group, and this again is my little personality quirks. When I see something that's a little squirrely, I want to jump in and fix it. There are times when it's appropriate to do that. And then there are times when it's not your job and it's not appropriate or whatever. How do we as a committee rustle up the right, you know, a group of people who are better positioned to do that, to do something like this, to sort of counsel them a little bit? I don't know if that's our job as a committee. But you know, social services, generally, there's excessive demand. The staffing is low. It's a system under enormous stress. I don't care if you're talking child protective, adult protective, or whatever. We as a society do a lousy job of looking after each other. And I'm reminded of what a couple of years ago when we were interviewing some of the programs and we went to see the community, you know, health workers attached to Land of Sky, and the woman who ran the program, and I'm sorry, I don't remember her name, you know, she made a comment that, you know, you can't empty the ocean a bucket at a time, and she just has to, you know, get her head around the fact that maybe she does a thimbleful a day and that's all she can do. It's hard. But I think if the system as a whole, if there was, you know, more professional networking around social workers, not that they have the time for it, if there could be a little bit more of a flow of communication and ideas among the folks who work in the system on the margin, I think that could help.
Well, I think, Suzanne, before I hate to interrupt, but I guess what I'm struggling with is a couple things. Like focusing on the committee and our application. I mean, how do we encourage our grantees to communicate? And then the other thought is, I was very disappointed that the SkyNav project is not going through, and folks on this call probably don't know what that is, but the Land to Sky had some scholars and they built a platform where an AI platform that collected data from reliable sources and was it was designed that a person designed that someone, say a caregiver, could call in and get information that was helpful to them without having to go to a lot of different places. And then and I lost the other thought. So I guess what I mean, oh, BASA. So I'm not quite sure how, I mean, the providers do come together with BASA, and maybe Billy can give a little explanation about that. Can you jump in?
BASA is Buncombe Aging Services Alliance, and it's quarterly meetings among the aging services providers via Zoom, and it's networking, and it's also learning about what other providers are doing in the community so that they're aware of what other providers are doing. And also it shares the same time slot with age-friendly Buncombe County meetings, and it's pretty much the same audience because we have providers share what they do, and it's networking as well, and we share that same time slot quarterly. And it sounds confusing. It's the third Wednesday of the month at 1 o'clock, and it was just a way to streamline meetings so people couldn't meet 12 times a year. So we share the same time slot quarterly. And then the last is a funded provider meeting for everyone that's funded by HCCBG and Buncombe County. And it's more about technical assistance or what's going on with the HCCBG advisory committee too, and the grant applications. And Susan sometimes leads those, but that shares the same time slot as well. So those three types of meetings alternate. So providers are learning what providers do through these meetings.
But I think to Suzanne's point, how does a caregiver or a new caregiver, enter into the sphere of aging providers? And
well, these meetings are open to community members. I send it out to providers, and I have an age-friendly email distribution list, and community members can attend any of these meetings. It's open to everyone, and we do have community members that attend.
This gets to one of the things that if we were going to talk about revising the application, I'd like to see addressed with the providers. How do prospective clients learn about the programs? What's the application process look like? How do individuals without a family member, friend, caregiver advocate get themselves through the application process, which can be very paperwork heavy? What are the challenges that they see faced by folks without caregivers? What happens, if someone is applying for services but really needs more services than the agency can provide? How do they redirect the prospective client elsewhere? And once you have clients who, as aging progresses and they need more services, how do the programs, again, redirect folks to other programs where their needs can be addressed? That, I think, if we put something like that into the application, we could get a better sense of, I think, of how the programs interact with the community. Because in my limited, statistically insignificant observation of these things, you know, we got to this a few minutes ago. People usually know when they need help, but they don't know if that help's available. And even if they suspect it might be, they don't know how to ask for it. So I'd be curious to hear more from our providers on how they address that issue.
I have another question, which is a little bit sidewise, but does anybody know, when people dial 211, are they able to give advice on services for the elderly? You know what 211 is?
Yes.
Yeah,
That's a good question.
Well, at the Council on Aging, I got a lot of calls from people who had called about a multitude of questions to 211, and they would then in turn refer them to the Council
Ah,
on Aging.
okay.
So that was kind of that blanket, and then we could make them aware of others. But I would be interested maybe on the application to see what other services our providers are aware of. And if they are providing referrals to those and how it links, kind of going on what Aunt Suzanne said. But I've been curious, are they even aware? Of course, with Billy sent out, they hopefully are aware, but there's even more services that we don't fund. But I would just be curious about that too. And 211 also, whatever else they know about, they will refer, but they don't follow through with advocating. That's another phone
Right.
call, maybe 6 phone calls someone has to make, you know, and go from there. And it is complicated. And face it, we're dealing with seniors.
Yeah.
I mean, it's hard.
I mean, it's almost like we should be asking the participants the questions instead of the organizations. And that was sort of the problem that I had, and I'm sorry I didn't
Good
send
idea.
anything in on this, but I did think about it. But the more I thought about it, I was, you know, making the providers write a term paper or something.
That's what I'm saying.
And didn't think that would go over very well.
Yeah.
But I mean, I think that is the root of what we need to get to, is what's going on with, you know, the folks and who gets in and who doesn't get in and why.
And I'll
It's a good
say,
point.
I just shared something in the chat. I believe the state is trying to pick back up with NC Care 360. It is a referral website that they are wanting to get all providers across the state of North Carolina connected to. If you want to, that could be something that you could ask in the application. Are you currently signed up for NC Care 360? If not, would you be willing to sign up for NC Care 360? So what essentially it does is, say someone comes into the Land of Sky AAA looking for meals or something like that. Yes, I can, of course, refer them to Council on Aging for Congregate and things like that, but there may be other resources within NC Care 360 that could help get them a meal that day, rather than them having to go and fill out a DOS 101 and then wait until they're able to get a meal. And I believe NC Care 360, there was a hard push for it, and then COVID happened, and we were all at home, and it just kind of fizzled out. But I do believe there is a renewed push that's coming through to get people signed back up with NC Care 360 as this kind of no wrong door ideology, so that they could even go to, you know, let's say they go to Working Wheels. If Working Wheels decided to sign up for NC Care 360, their expertise wouldn't just be in mechanics, it would also be pretty much everything that's available through that NC Care 360. The only issue with that is the providers have to sign up for it. They have to sign up for it. If they don't sign up for it, the services are not listed there. So it could be something that we try to push for with our providers. I know that there's a lot of people that are already on it and they use it. But yeah, that's one of the things that you could potentially ask of providers.
so Zach, the NC Care 360 does ring a bell, but can you maybe help us understand how a Working Wheels organization would, do they go online and say this person needs X, Y, and Z? Can you just maybe give us a
Yeah.
little bit of flavor?
So they can, if they create a profile for themselves, they can go online. They can receive referrals. So if Council on Aging receives a client who's looking for car repair, they can actually send a referral over to Working Wheels, and Working Wheels can either accept, decline, or send the referral to someone else if they don't feel that it is appropriate for them. And all it is you would go in, you would create a profile, and once you get started, it's like a Google search. You can search, this client needs food or nutrition, or this client needs daycare. This client needs, any number of things, and it'll pop up with all of the services across the state that offer that, and you can narrow it down to county or even city, I believe. So, you can get that specific with it.
So if they had gone in, so help me out, I'm trying to visualize this. So someone goes to Working Wheels, they start chatting with the folks at Working Wheels goes online and puts in the profile for the person, or is it the profile?
They would put in a referral request, and it would have that person's information on it. No sensitive information, more of just, this client is X years of age, this is their phone number, and this is what we talked about and what they are looking for. And they would send off that referral. And the referral would pop up on someone's screen at the location where that service is offered. And it's
Okay.
that person's responsibility to take action on that and give that person a call back and kind of go through the process with them that they need to go through.
Thank you.
We used NC Care 360 when I was working at the Council on Aging, and I received referrals through, I think it's a database system, but I would receive the referrals, and then I would help the client, and then I would send back what I helped the client with, whoever referred, so they know that I helped the client. But my understanding is that a lot of providers aren't using it right now, and I think there's not funding for it. We talked about this during the Age-Friendly Advisory Committee meeting, about this NC Care 360. So I don't know where it stands, but I thought there wasn't funding right now or yeah.
Yeah, I keep hearing the same message there, funding. Sorry.
And to me, this whole conversation shows that we need an active aging center. Because aging services is fragmented, and we were making progress several years ago, and then it got stopped because we were gonna have all these providers in one place, and there'd be one application, and it would simplify the process for all the clients and community members.
I remember when I first joined the committee, was this 2 years ago, maybe 3 years ago, there was discussion around an active aging center on the University of North Carolina, Asheville campus. They were going to provide some space.
Mhm.
What happened? It was never clear to me how that died, if it completely died, if it was put on hold. Is that whole initiative dead now?
Yes,
Yes,
yes.
sorry.
The county commissioners liked it, but there was too many other priorities. that it wouldn't come until 5 to 10 years down the road. And then, of course, we had the impacts of Helene and the funding, and it's died unless someone else can pick up the torch.
The figure I'm remembering was 27 million. Yeah,
Yeah.
to build the active aging center was $27 million. So as a committee, as we look to our application and to our mission statement, I liked what Suzanne said about coordination, building the capacity within the community. So perhaps that's a phrase that we could put in our core, I don't know what we want to call it, our core mission, core philosophy, that we want the folks to be we want them to be safe. They want to be in the least restrictive environment. They want to be able to have quality of life and contribute to society. And then while that is the mission of the providers, there is also the mission to reach out and build the capacity. And things like, are you, do you call into BASA? Some of the more specific things, I can't remember if it was Eileen or Deborah or Suzanne said about, do they have, how many, how do their clients find out about the service? How do they coordinate? So
And
I'm sorry.
oh, I'm sorry, I was interrupting. I'm sorry.
No, go ahead.
I was just thinking, and do we want to add something about promoting independence? I hear that a lot from the elderly. They feel not only invisible, but they fear losing that independence, and most of these programs are supporting their independence. So just a
Transportation.
thought. Yeah.
No, I like that. Yeah, because transportation was another big
Yes.
issue. Well, I have on the clock, I have 4:27. I want to be respectful of everybody's time. I think today was an excellent conversation. What I'll volunteer to do is to draft up, I don't know, what do you want to call it, philosophy statement, and share it with folks, and we can kind of go from there. And then start looking at the application and the scoring tool. I think that's going to be a longer process and probably one that would benefit from in person. But I do appreciate everybody doing the Zoom today because I need to be in Hickory at like 6:30.
Uh-oh.
Uh-oh. So I don't know, is there any last minute comments, questions? Well, as always, I cannot thank you all enough. You are fabulous, just wonderful, excellent. I'm honored to be a member of this committee. So y'all have a good evening.
Thank you. Thank you. You as
Thank you.
well.
Good night.
Good night.
Thank you. Bye.
Bye.